Hi, everybody. It's Dr. Carolyn Ross here, and tonight I'm talking with you about binge eating. What is binge eating, and what is binge eating disorder? Is it really a disorder? So those are the things we'll be discussing briefly tonight. So let me just describe one of my patients who struggles with binge eating disorder, and she says her name is Melinda, and she's a successful businesswoman, and she has this problem, and it's really causing a lot of distress in her life. And she says, I binge so much, and I know I should stop, but I feel completely out of control with my eating. And I eat so much that my stomach hurts and I have to lie down. Sometimes I feel like if I don't eat everything I can get my hands on, I'll explode. So her words highlight the anguish that many people with binge eating disorder feel. Now, most of you have heard about anorexia and bulimia, but maybe you haven't heard about binge eating disorder. Binge eating disorder is the most common eating disorder, more common than anorexia and bulimia combined. And it affects 2 to 5% of Americans, or about 4 million people in the U.S., and it can affect children as well as adults. And of those people who are going to any commercial weight loss program like Jenny Craig, Weight Watchers, blah, blah, I don't want to give them too much credit here, about a third of them actually have binge eating disorder, and being put on a diet will make the binge eating disorder worse. Now, what's interesting about binge eating disorder also is that it almost has as many men as women, and that's completely different for anorexia and bulimia. So about 40% of those with binge eating disorder are men. So here are some of the ways you would know if you have binge eating disorder. And I'm going to put in the note below, you'll be able to access the binge eating disorder quiz to see if you might have binge eating disorder. So look for that in the notes. So if you have periods in which you eat large quantities of food in a one sitting, or about a 2-hour period of time, that's what the definition of a binge is, then you may have binge eating disorder. Now, other symptoms of binge eating disorder include trouble controlling how much you eat, just as I mentioned with Melinda, and feeling powerless to stop how much you're eating. Even though you're not hungry, you may be eating when you're not even physically hungry, or you may be full from binging and you still can't stop. After a binge, you may experience emotions of disgust, shame, or embarrassment about your behavior. So, this can lead to social isolation because many people with binge eating disorder don't go out. They don't want people to judge them for how much they're eating, and they have so much shame around it. It can affect relationships because if you can imagine, how your binge eating disorder will take up so much space in your relationship, it may be difficult for you to, have a normal, healthy relationship. So while dieting may be associated with binge eating disorder, in the majority of people, usually the binge begins before they start dieting. So this is important. I'm going to give you another example because it's important for you to recognize that binge eating disorder is not just somebody who, just wants to eat a lot. It's a really difficult disorder that causes a lot of emotional distress for the people who struggle with it. Here's another person, Jennifer. Now, Jennifer's mother died when she was 8. At the time, her father sent her to live with her grandmother, who was kind of cold and emotionally disconnected and not too happy about having an 8-year-old to raise. So then she began to sneak food and binge eat. After gaining weight in middle school, she was put on her first diet, a very strict diet. As well, she had been being ostracized by the popular girls who teased her about her weight. And after every episode of binging, she just felt ashamed and disgusted with herself. In high school, she was diagnosed with depression and put on medication, but couldn't stop binging. She felt so isolated and alone. She tried to make a fresh start in college, vowing to not to binge anymore. But in college, she felt even more pressure to fit in and began dieting to lose weight. When she felt fat, her whole day was ruined. She knew she should stop, but she just couldn't do it, often eating to the point of, having abdominal pain. She felt caught up in the vicious cycle of binging and trying not to binge and dieting and then binging, and it was literally ruining her life. So I'm hoping that gives you a little bit of a sense of what people with binge eating might be struggling with. Now, some of you may want to know, well, what's the difference between binge eating and overeating in general? Well, first of all, um, both may be both people with binge eating disorder and compulsive overeating may use food to deal with their emotions. Both may feel embarrassed and upset about difficulty controlling their behaviors, and both may also eat when they're not physically hungry. However, for example, in Jennifer's case, she has specific periods of time when she eats a large quantity of food. For someone who just overeats or is a compulsive overeater, they may tend to snack all day or eat more at meals. But the binge is a discrete period of time where you're sitting and eating a large amount of food. And often people will obsess about their next binge, planning how they're going to go to the grocery store and go to a store that's far away from where they live so no one will recognize them. Or, pick up food in the drive-through and pretend like they have someone else at home besides themselves to explain the large quantity of food. So there are several risk factors for binge eating disorder. Of course, genetics can be one of them, which we'll discuss in another podcast. Low social support, obviously the pressure to be thin, which is on all of us, emotional eating, depression, low self-esteem, and bullying by peers, as well as childhood maltreatment or childhood loss or childhood adversity. So, for example, in Jennifer's case, losing her mom when she was so young is clearly a setup for her binge eating. So and the question is binge eating a disorder? And yes, it is. It is currently in the DSM-5, and so it is no longer kind of a stepchild in the eating disorder world. It is considered part of the eating disorder spectrum. On the next video that I'll be coming to you to talk more about binge eating disorder, and we'll be talking about overcoming the 5 most common pitfalls in binge eating disorder. So how do you overcome resistance to making a change in your binge eating disorder? And we have lots more this month on binge eating disorder. So again, look for the binge eating disorder quiz below the video. Please, please, please subscribe to my channel and turn on your notification so that you can get notified immediately when we have uploaded the next video. So take the quiz, and I look forward to talking with you soon. Thank you.